Hello, today we are working on knee strengthening and knee corrective exercises. So first we're gonna start with a roller. We could do with a foam roller or we could do with a hand roller. We start with hand roller, and then when we can progress, then we can take out the big foam roller and put the body weight on and do that way. But today we start with calves. We're gonna inhibit, we're gonna work on calf stretching. And we start out with a hand roller, like I said. I put my foot on something. Could be, I have Ottoman here, example, but it could be anything. And then underneath my knee, and I'm gonna start rolling my calf. You could go lateral side, most likely lateral side is kind of when you're feeling that you need a stretch. It's called hypertonicity. Or medial side, you can go this way. So medial and lateral. Medial side, I'm stretching my calf like so, and the lateral side. So this one, about 30 seconds to 60 seconds, I like to do. Good, good. And then, of course, we're gonna switch sides. Good. Now I'm doing my medial side. I'm feeling that I need some stretch. You could even push some pressure on, put some pressure on. And then, of course, lateral side. Put pressure on for 30 seconds if you can. Again, 30 to 60 seconds. And then if you feel like that pressure is not working for you, you could just do kind of rolling. It's also very, very good. Good. Next one up is we're gonna go ahead and find our hip bone. Lateral side of the hip bone right here. We have TFL, and from TFL we're gonna stretch, and from TFL we're gonna go down to IT band, like so. All right, so hip bone, lateral side of the hip bone. Do not put on the bone, obviously. And then now we're gonna find that tight muscle. Most likely you feel that muscle almost immediately. And then I put slight pressure on. I would have to say with a foam roller, I'm feeling that stretch a little bit more, but this works as well. And then we're gonna go ahead, I put my foot again on something. And then now I'm gonna go for IT. Most people have very tight IT bands. We're going back and forth, close to the knee, not on the knee, towards your hips, back and forth, and that's how we're rolling. So I'm on a corner of your thigh. So front, side, and corner in the middle. Going back and forth, going back and forth. Just like that. Just like that. If I'm feeling really tight spot somewhere, I'm gonna put the pressure on for 30 seconds. I am not feeling that much right now. Maybe a little bit here. Okay, right here. So I put slight pressure on. Don't break your tool. I have handmade tool here. Super excited about that. I made it. Super cheap. If you're interested, let me know. Anybody can make it. Good. All right. IT, hip bone, lateral side of the hip bone. Put the pressure on here. Find that IT and TFL. Well, this is TFL actually. Good. You roll it, roll it, roll it. Roll it, roll it. Some pressure on. Some pressure on. And then from here, we're gonna go for IT band. Oh, this side I'm feeling a lot more. So I need it badly. We all do. Going back and forth. And that's very common too. So one side could be so much more painful. That means you have these, I call them yarn, like a bundled yarns in the muscle fibers. So when we put the pressure on, we kind of want to push these bundled muscle fibers along with the normal muscle fibers. Yep, going back and forth, going back and forth. Good. All right, so Next ones up are standing calf stretch. Put two hands on a wall, step forward like so. My back heel is on a floor and my knee is straight, and I'm putting pressure on the wall this way. So you start feeling on my calves. Wherever is a tight spot, you start feeling it. So you push it, feel it. 30 to 60 seconds. I am not going for exact, close enough. I know that I'm not going less than 30. So that's the key. You don't want to stretch less than 30. Otherwise the stretch won't work. Okay, and then of course we go on the other side. My back knee is straight, heel is towards the floor. Actually it's on the floor. Good, I put the pressure on the wall and I push my body almost away from the wall. Very tight calves. Very, very tight calves. Good breathing would help here. Very nice. Next one up is standing adductor stretch. So inner thighs, adductors. Or I'm going to show this on the side. I step to the side, pretty wide step. And then I'm almost like lunging. What does that mean? I push my hips to the back and then I start feeling in my inner thighs. So if you step just a short step, you're not really feeling anything. Pretty long step. I push my hips to the back, nice straight back. And I'm feeling nice stretch here. So this side is loaded and this side is lengthening. It's a nice stretch, hold. And then I'm gonna go to the other side, hold. So you could even slightly push that foot to the floor, hips to the left in this case, and a nice stretch here. I'm going a couple times like this. So left side, right side. If you could hold 5 seconds, 10 seconds, later on maybe 30 seconds, or even 2 seconds is good, this one. In that case it's active prepping. Good. Next one up, I'm just checking here, is on the floor for bicep femoris stretch. Okay, a couple more times, it feels good. Good. So key here is that you wouldn't be like this. So nice hips back. Good. Next one up is on the floor. Nice and slowly on the floor. My low back is on the floor. One knee is bent, the other one goes straight up like so. So my right leg is up, my left fingertips go around my right knee. I pull that full leg, almost straight leg. It's not going to be completely locked knee. I'm bringing all the way to my left. So my right foot is up, and then bring that whole leg to the left. I'm doing my right side right now. So my fingertips here are tendons. I'm pulling these tendons a little bit. So it's like I'm hooking my fingertips there. And now from here, I'm feeling a stretch in my hip already, but I want to feel here, almost like behind the knee or the whole thigh here, back of the thigh. So I'm lengthening my knee almost completely if you can, and then release. So my foot is over across my body, my leg is over across my body. I'm hooking my fingertips here. My foot is straight, and then release. My knee is straight, foot possibly toes towards my body. So you don't want to point your toes. You want your toes towards you, and release. 6 times, 10 times. Probably in the beginning, 6 times is fine. Even 5 is good. Anything you can do really to start out. Good. And good. All right, other side. My opposite knee is bent. I'm bringing over my left whole leg, my right fingertips hooking behind my left knee, around and behind. And from here, I'm lengthening my knee and I'm releasing. This one you don't want to hold 30 seconds. It's slightly too much. So push it, hold 2 seconds, maybe 3, and release. Definitely in the beginning, you don't want to go more than 3 seconds. Especially if you haven't worked out and exercised and stretched for a long time, or maybe never, also possibility. Good. Let's do a few more here. Yep. So I'm lengthening my knee and I am pointing, I'm pulling my toes towards me. So I'm feeling all the stretch in the back of my thigh here. Let's do one more, why not? Good. Next one up is, I'm just checking here. Next one, floor glute knee for the floor glute median. Okay, so working on, so glute max, glute median here. This muscle is so overlooked and undertrained, I would say. So I like to bend my knees first, and then I bring my top knee straight and slightly even behind me. So here my elbow is underneath my shoulder. If it's too much for the shoulder, you can put the yoga block or something underneath your head, or just like this, and then you relax in here. But that's only if you need to be this way. So let's say you're okay with this position. So you have your elbow underneath your shoulders. My bottom knee is bent because I have better balance. You don't have to bend it, but I like to. And then from here, you can bring your heel up like so. Core is engaged, of course, you're not slouching. And bring your heel up. Hold a second or two, straight knee. And down. Up, hold it, and down. Up and hold, and down. Up and hold, and down. That's 3, 4, 5, 6. Let's go for a 12 and 7. Switch slightly this way. See myself better. Let's say 8, 9, 10, 11, and 12. Good job. Alrighty, other side. I am a little bit off the camera for some reason. Gonna go a little bit farther. So like that, both knees bent. Top is straight and behind. So my back toe is behind my front heel. Good. Good. And 2. And 3. Elbow again. 4 underneath my shoulder. 6. Start feeling here. 7. 8. 9. 10. 11. 12. Very good. You could do this twice. I am not gonna do this twice, but you can do this twice, maybe first couple weeks once, and then go to twice both sides, about 12 repetitions. Next one up. And next one up is a bridge. So this bridge, we could do it on the floor or with a ball, excuse me. So my low back is on the floor, and this is a bridge, just a regular bridge, old known bridge, hands on the floor. So what I don't want you to do is this, that you arch in your back from here. So you don't want to have space here and then bring to the bridge. So no. So you want to push your low back to the floor and engage your glutes, and then bring your hips up high without too much using your legs. More like so you want to use your hips. Okay, hold it 2-3 seconds and release from the top spine towards the tailbone. Again, low back on the floor, core is engaged already. That engages your core, but you could exaggerate that more, that you could pull the belly button in towards your spine. Bring it back up, hold 2-3 seconds, and release. Yep, try to look straight. I am talking to the camera as I'm looking towards the camera, but ideally you want to look straight ahead. Go back to the floor. You're bringing your hips up high without too much using your legs. You can use your legs, but more think about your gluteal muscles. Hold it, contract your glutes as much as you can. Engage your brain and your glute max. That's what you're working on. The more you can feel, the better it is your neuromuscular system, which is the nervous system, and your muscular system. Hold it, squeeze it, and first time 10 to 12 would be really good. First week, maybe 2, it depends how many times per week you're doing it. Ideally you want to do minimum 2 times per week. 3 is even better, no more than that. So I lost count, let's say about 6, let's do 4 more. Good, all the way up, squeeze and hold. Nice. Let's do 2 more. My low back is on the floor, pushed. Core is engaged. And bringing up. Good. Hold it, engage it. Crush your glutes. Release. Everything is slow. Slow is harder and slow is better. I have so many clients asking like, am I too slow? I'm like, no, you're not too slow. You're perfect. So slow, to do the exercise slower is better. And it's more challenging actually. Hold it, hold it, hold it, hold it, and release. Very good. Next one up is, let's see. Okay, so we have a little bit more to go. And then we're gonna work on single leg balance reach. So we could hold on to the wall, hold on to the foam roller, hold on to anything. So make sure you don't fall. I'm gonna hold on to the wall. 2 feet hip width, and I shift my hips to left side at the moment. So when I'm shifting, you don't want to do this when you're shifting. All you're doing, you're holding your hips square and you're shifting to one side. And then from here, you're standing on one leg. Okay, so I'm going to hold on to the wall. Standing on one leg, my opposite foot is elevated. And from here, 2 things you could do. Well, more than 2, but you're gonna bring your leg up like so for 90 angle and hold maybe 10 seconds and then release. You can put the foot to the floor or not. And again, possibly 10 seconds and then release. If you could hold on your foot up 30 seconds would be really, really good. Or if that becomes really easy, you could do from here. Nothing else moves, only the side of the leg, straight knee, and release. You go in front. Good. Diagonal. Sorry, this is side. And diagonal. I'm not going straight back like so. I'm going diagonal. I'm holding 2 seconds and release. Front hold and release. And keep going. I'm going to show other side too. First one, if you just start out, 2 feet hip width, I'm shifting to one side, which is my right now. Either you go in and hold in 10 seconds, you can put your fingertips on a ball, or if it's easy, just take your hand, put it on your hip, hold. And then release. Let's say 10 seconds, 20, or 30. If that becomes easy, and you're not holding to the wall, we could go straight knee, stand on one leg, hold, 2 seconds, hold, sideways, I'm holding 2 seconds, slow release, and diagonal hold, 2-3 seconds. You could do all of these for 12 repetitions. Last exercise, you need the wall only. So all of these exercises you can do it at home. So my low back is on a wall like so. I'm looking straight ahead. And I'm releasing my hips towards the floor. And when I look down, I want my knees above the ankles. So you don't want to be like this. That's not good for your knees. All your body weight is on your knees and you can have knee pain, which we're trying to avoid right now. So feet are hip width or slightly wider. I'm like almost 2 feet from the wall, and then either hands on your hips or here. I like it here. I'm squeezing my fingertips, and I'm slowly sliding down. So you can go for 90 angle, or maybe in the beginning you're not going 90. You're just holding here, possibly maybe 10 seconds, and then push your back up. So slightly, this is wallpaper, it's not slippery. Actually the door would be better, or something slippery, because you can slide up a little bit better. So I'm gonna have to kind of wiggle myself up. So I'm going down. When I look down for a second, normally when I look straight ahead, but when I look down for a second or two, my knees above my ankles. So I'm feeling my quads, maybe slightly, sometimes knees are cracking, all kinds of things. And hold it maybe 5 seconds, if possible 10 seconds. If that's pretty easy, you can hold longer and then stand up. Key here is make sure you're not slipping. I'm on a carpet with my socks, it's okay. Ideally you want to be non-slipping situation. Maybe with shoes or barefoot, whatever works, make sure you're not slipping. You could put a pillow underneath your hips here in case you're sliding and then you're falling, example. Obviously we want to avoid something like this. I'm going down, my chin is back, my back of the head is touching the wall, squeezing my fingertips. I'm holding this position for whatever amount of time it is. Maybe 5 seconds, 10 seconds, 30. If you could get this position for 45 seconds, would be amazing. And then I'm gonna have to push myself up because I can slide up. All right, let's see. I think that was it. If this gets easy, please let me know and we can progress from here. Thank you so much.